Our next guest today on Community Focus on Washington County is Dr. John Isaacs Jr., who is here with his dental care program.
Right.
And Johnny, I can't say enough about how much information I need about dental care.
You do a fine job, Lisa. Don't sell
I mean,
yourself
really,
short.
you know, these are things that we as parents need to know for our children, and as you know, children need to know as they're growing up, because you only get one set of teeth.
That's right. However, you do get two sets. You get your baby teeth too.
Well, that's true. That's
I'm
true.
just-
But you got to start caring for those too.
Yes, you do. Yes, you do.
Yeah.
Uh,
So I wanted to start out today with asking you about a toothbrush.
Okay. That's first and foremost, you have to choose the right instrument, the right tool, the right weapon, if you will. Most people, when we were growing up, Lisa, it was all you could get was one size fits all, and it was a hard toothbrush, and we thought those were fine. Except as people kept their teeth longer, we were finding a lot of abrasion on them, on the teeth themselves, because of the hard toothbrush. We were recommending people to brush their teeth 4 times a day. Now we pulled back a little bit on that, and we're just asking people to do it twice a day. If you can get 2 good brushings in a day, you're doing pretty daggone good, a lot better than most people. It's hard to believe, but a lot of people kind of skip that part of their hygiene routine. So if you can get good, when I say good toothbrushings, you want 2 a day. Now, as far as the toothbrush, you want to try to get a soft or ultra soft, as soft as you can get it. I was talking to Gary the last time we did this. You can usually get them at any good drugstore or some of the big box stores. If you get one at a convenience store, a lot of times all they have is the hard, because I've done that several times, and that's about all they have. So if you can't get a soft one, you want soft bristles, and make sure you don't get one too big. That's a lot of people can't open that wide, and they have a hard time getting it all the way back to the molars. So if you can, even get a child toothbrush if you need to, go ahead and do that. So we have a lot of adults in my office that actually request a smaller toothbrush, and that works out too.
So you want a soft one,
Soft.
because the hard ones make too many abrasions on your
Exactly,
teeth.
because over time it will wear.
Erode your teeth?
Yes, it'll wear it down. Just like a water would wear on a rock. Over time, it's going to do that to the teeth too. We see a lot of young adults too that have abrasion. So let's talk about. So we got the tools down. We want a soft toothbrush. Okay. As far as how long do you brush? Hard to believe, but people we want them to brush 2 minutes, and that's a very long time.
It is.
If you can get, I've got to be honest, I don't do it 2 minutes. And I'm kind of fanatic about brushing my teeth. I do it. It's kind of a nervous habit that I've developed, I guess, because I get free toothbrushes and I just kind of grab them and go through it. But we'd like for you to do it for 2 minutes at a time.
And why is that?
Well, just because because it takes that long to do a good, thorough job. Now, the big question is, do you brush up or down or sideways? Well, we use what's called the Bass technique, and I was talking to Tina Borders, one of my hygienists today, and I was asking her some few pointers, and that's what she brought up, and I remember that from years ago. But it's just a technique for brushing your teeth. So instead of brushing it sideways, you want to go up and down in a circular motion. Why do you do that? Just because if you go sideways, you are going to wear the gums. The gums will recede a little bit if you do that. Over time, it can recede quite a bit. I've seen people actually dig in their teeth and get into the nerve of the tooth from doing it too much. You can overdo it. And a lot of times you can see the dominance of right or left-handed from that. So, because a lot of right-handed people will scrub real hard on this side and ignore this side. So it's, you can kind of see, tell that. So you want to make sure that you do it for 2 minutes in a circular motion, and also you want to start on the upper and work around. Start on the upper right and work around, and then start on the lower and work your way around. Why do you do that? Just because of gravity. All the suds and debris will come out, and then you can go ahead and expectorate into the sink and get rid of all the debris. Okay, so you start on the up, go around. Another thing you want to do, and a lot of people won't do this because we get in the habit, you want to switch which side you do first. if you get in the habit of switching from the left side and then start to the right side and then start on the left side sometimes. You say, why do you do that? Because we are all creatures of habit, and we get in our lazy habits. And what happens is the phone will ring and you got to stop. Well, you only got, instead of getting your 2 minutes in, you only got about 30 seconds in, and you did the same spot you did the last 8 times, and you're forgetting the other side. And that's very common. And a lot of people say, why am I getting all the cavities on one side? Well, you're probably not brushing as well on that side. Another point that I want to make, whenever you have your toothbrush in your mouth, you want to angle it toward the gum at about a 45-degree angle. And that's so those bristles can push up underneath the gum and clean the gums too. A lot of times when I tell people brush your teeth, I'll say brush your gums. But we don't emphasize that you need to brush the gums too, because that is where the gum disease will start, below the gum line. So you want to make sure that you get all the debris out of the gum line. We can almost always fix the teeth, but once you get gum disease, that is a much more difficult thing to repair. It's very costly too. A lot of times we have to send you to a specialist, and you don't want all that if you can be prevented. Most dental maladies can be prevented with a little bit of oral hygiene. If everybody did exactly what we said, you could put us out of business pretty quick. So go ahead and do it. I challenge you to go ahead and try that.
Well, that's not going to happen. And one reason I can tell you on that is because you're not saying anything about genetics either, Johnny.
Yes, that plays a big role too.
I know that my mother suffered with gum disease, as have I. So, and I know my children, I have been very cautious to tell them that they have to really take care of their gums, because I know the first time I came to you about that, you said genetics.
Yeah, and you see it a lot in families too.
Yeah.
But if you can get in there and work it, and everything usually comes out fine. And the people that we see on a regular basis, I mean, they're usually in pretty daggone good shape. You know, we don't see a whole lot of problems with it, and we love to give good news. We see so much problem in there, and then extracting teeth. That's what I did all morning. It seems like let's take teeth out, and it's almost always preventable if they come on a regular basis. So that's another thing that I recommend doing. Some people don't need to come twice a year. Once a year is fine for some. Most people, however, do need to come twice a year. Some people more often than that. If you do have gum
for
problems.
a good checkup and cleaning.
Yes, exactly. And as far as a toothpaste, which one to use, it's better if you. A lot of people want to get the whitening toothpaste. Those are somewhat ineffective. When it says whitening, what it does really is an abrasive toothpaste, and it knocks. If you have a lot of stain, i.e., if you have tobacco stain or tea stain, coffee, it's pretty good on that. So if you have coffee or tea, cigarette stain, it's pretty good because it's abrasive. But if you just want to whiten your teeth, it won't do that. Over time, it's actually going to make them more yellow because it will. The enamel is whiter than the dentin underneath. So if you wash away the enamel, you made your teeth even more yellow. So don't do that. Make sure you have stain in order to get it off. Most people don't really need that.
What kind of toothpaste should you use?
One with fluoride. It's hard to get one now without it. They're all essentially the same. The patent went off years ago, probably 20-some years ago, that the patent went off. So almost all toothpaste have the stannous fluoride in it. It's hard to get one without it. Now, some people don't want it because of allergies, or they just think that they're getting too much of something. It's hard to get that. I haven't seen it in years, to be honest with you. But if you almost any toothbrush, I would stay away from specific tartar control. There again, that does have the abrasive particles in it. But if you want to get, there's something called Total. I think Colgate has Total, and it's been proven to be good for the gums as well. So it really doesn't matter what toothpaste, as long as you use it. That's what Gary and I were talking last time. As long as you can get in there and use it, it's people not using it is the problem. I even mentioned if you go camping and you forget your toothbrush, or you're out somewhere and you don't have one, use a washcloth. Dampen the washcloth, get it wet, and just scrub the heck out of it, and then at least you're mechanically removing the debris. Which, when I say debris, I'm talking about bacteria whenever there's a certain type of bacteria, Streptococcus mutans, when it's been fed by sugar, it produces an acid, and that's what eats the teeth, not the gums. It's a different one. Several bacteria destroy the gums. Only one destroys the teeth, which is pretty amazing. We have over 200 types of bacteria in our mouth, but only one of them causes tooth decay. Isn't that crazy?
And so I guess it's really important when you're talking about brushing twice a day that you brush before you go to bed. Because you mentioned that, I think, on a previous program.
Did you watch that?
Yes.
Good.
Because, sometimes late at night, with children and things, they just want to get in the bed.
Right.
They don't want to brush their teeth but you indicate that it's really important.
That's the most important time because you brush your teeth before you go to bed. When you're sleeping, you're not salivating as much. You don't have as much natural lubricant or to wash out the debris. So yes, before you go to bed. So if you can do it before you go to bed and knock in another one before you run off to work or school, that's pretty good. Now, I really think that if you're going to school and you're eating a lot of sugary snacks, you probably ought to brush more than that. Let's talk a little bit about sugar intake. All these high energy drinks, a lot of kids are taking these things and they get addicted to it. I see a lot of people that drink a lot of Mountain Dews, and Mountain Dew just seems to be the biggest offender there because I think of the caffeine. They get addicted to the caffeine and they need to feed that addiction that they have. So they're pouring that sugar right on it and they're feeding it constantly. And when you're sipping on it, that's the worst thing. You could eat. I tell people you could take a thimbleful of sugar and just kind of dip it in there about every 15 minutes. You destroy your teeth. But you could eat a whole cup of it in one sitting, and it wouldn't affect you. So it's really not the amount; it's exposure over time. So that's why it's important to brush and floss. We haven't mentioned flossing yet.
Oh yeah.
Now my notes there that I gave you, I didn't really touch on that, but flossing, and you even sighed when I said it. That is as important, maybe more important for the gums. If you can floss and get in between there daily, you're going to almost guarantee you won't have trouble. I meant to bring some floss here so I could demonstrate how to tie it up. But whenever you do it, a lot of people will just get a little piece of floss and try to do it, and they get frustrated. Take out about 18 inches of floss, wrap it around your middle finger, both middle fingers, and that way you can have your thumbs to work it in and out. And you want to why 18 inches? Because you want to, each time you go in between there, you want to move that floss just a little bit so you don't contaminate one area from another area. Because the bacteria there you can actually move the bacteria around to where you don't want it. So that's a little tip. But
and I suppose you should do that before you go to bed at night.
That'd be the best thing.
To floss them.
Yeah, and there are prescription mouth rinses that we use, Paradex, which is chlorhexidine, that we prescribe to some people if they need that too. And that's good too. You don't want to overdo that either. That's why we recommend only doing that a couple times a day. You don't use it as a mouth rinse. You use it after as a adjunct to brushing. You want to make sure that you brush and floss first and then use the prescription. But we'll go over that if anybody ever needs that.
Well, now, tell me about the floss, because I always have a hard time determining what kind of floss to get.
Okay, get any kind you want to use. It doesn't matter. You can get. They've said there's been studies about waxed and unwaxed. Wax leaves a residue. Don't worry about that. I mean, if you're worried about leaving a residue, you got other things to worry about in there. Go ahead and floss. Whatever is good for you. Whatever you like. Some people have bigger gaps between their teeth, and they'll have to use a different type. It's almost like it starts off as a thread, and then it kind of comes into like almost a cord, like a yarn, and then you can get it in there, and that works for some people too. Glide is that's another brand name. A lot of people, if you have a hard time, if you have tight contacts, then you can use the Glide, and sometimes that will glide it in there a little bit easier. But really, just anything you can use.
Yeah.
So don't worry about.
What about those ones that with the little pick thing that
Yeah, they're
has
good
the
too.
little floss thing on it?
We use,
Are those okay too?
They're fine. I've got them to the little flossers, I think.
Yeah.
I forgot what it's called.
Yeah.
But yeah, they're good. And if you have a lot of dental work, if you have bridge work, which fixed partials, fixed means you can't take it out. You can get underneath of it. They make little. If you have one, probably your dentist told you about how you clean underneath of it, and that's important too. You should do that once a day also. So and I do that. I've got a bridge, and I use it once a day. So
Well, I think it's important, like you said, for people to know how, not just brushing, but how to brush. And with the floss as well, I know, your dental hygienist has shown me, because there's a method to that as well. It's not just shoving it between the teeth. It's, working it in there to one side and then the other. And
I just want to emphasize, don't the kiss technique. Keep it simple, stupid. Don't get all bent out of shape about how you're going to do it in your technique. The fact that you're getting in there is encouraging. And keep doing it. Okay? You will improve on it if you haven't done it. And I see kids throughout the county. They don't brush, and I've had teenagers I've taken all their teeth out. I mean, you wouldn't believe it, but they're 19 years old, and it's just horrible. You just take their teeth out. So we want to avoid that, and it does happen. It does happen. And you got people coming in. They come into my office with a big can of Mountain Dew or one of those energy drinks, and they're sitting down because you can just tell they've been sipping on it. When I see that, I know they're going to have a bunch of holes, bunch of cavities that we're probably going to be taking teeth out.
So you discourage people from drinking all of those kinds of things. They've got sugar in them, and they're sipping on them, and
they're also very acidic too.
And very acidic.
The sugar is the main culprit, but they're acidic too. Even if you have a diet drink, it's still acidic. So you're not really feeding that bacteria, but you are causing tooth problems in there with the acidity of the beverage itself.
Okay, so it doesn't serve to drink a diet Pepsi or Mountain Dew.
It's better than the.
It's better than the
yes,
plain.
Certainly, without
but you're better off not just cutting.
I mean,
every now and then.
You have to live life.
But
so go ahead and enjoy yourself, okay?
Yeah, but you can't drink them all day long. Is
no,
what you're saying.
Don't sip on it all day long. And
Yeah.
those are the people. They know.
Yeah.
I've had people in there just recently, last week, tell me that he was drinking 10 Mountain Dews a day. I forgot it. We were, then we showed him how much sugar's in each Mountain Dew, and it's really. You wouldn't, if you saw that, you probably wouldn't do it.
Yeah.
But we do a lot of things we're not supposed to.
Well, I mean, we all need to know, though, because, I never thought about, because I like Diet Mountain Dews. I don't drink them very often, but I do know that.
Go ahead and drink them. Diet Mountain Dews are fine. And the real ones are fine, too. You drink one a day.
I'm not going to sip on that all day long.
Don't sip on it. Go ahead and drink it. I used to take one at 3 o'clock in the afternoon.
Yeah.
That's when you hit your kind of, you kind of hit a low.
Yeah.
At 3 o'clock, I used to go grab. It was a full.
It was for the caffeine.
It was for the caffeine. That's what I wanted. It was loaded. I had it. It wasn't. I told the girls not to get me diet. I wanted the real thing. And I've quit doing that. But I still like a little bit of caffeine in the afternoon. I'll grab it. So.
Yeah.
But it's good. Get Pepsi up. You can get through the day.
Well, and so then, we need to talk about mouthwash. So, because after you brush your teeth, should you use a mouthwash?
Sure. Try to get one without alcohol in it. They make them now. There's a product called Zero. I don't know what company makes it, but I've seen it. And that's the kind I've seen it in our office. They must be sending us samples or something. So Zero is written out. It's hard to get them with alcohol in it anymore, I think. Maybe Listerine still might have alcohol in it, which is good. I mean, alcohol kills bacteria. It's just that it can be carcinogenic too if you have too much alcohol in there. If you're doing it a bunch of times throughout the day and you're loading that alcohol on top of that, and if you smoke in conjunction with the alcohol consumption, then that's as far as having a carcinoma, cancer, that's a problem too.
Oh.
So if you think about it, even if you're not drinking alcohol and you're using a mouthwash, overdoing it 4, 5, 6 times a day, you could be setting yourself up for problems with cancer, oral cancer.
Is alcohol associated with
yes.
carcinomas?
Yes, it is. Yeah. Alcohol. It's usually tobacco and alcohol in conjunction. So it's people that smoke and drink in conjunction causes it's called a squamous cell carcinoma. It's rare, but if you get it, it's not good. It's not pleasant at all. And I've been doing this 28 years. I maybe see about three, maybe 4. So it's not very common, but if you get it, it's bad. So avoid the alcohol and in conjunction with cigarettes. Almost always those two together.
Are you talking about alcohol?
I'm talking about
Regular alcohol.
Exactly what. Yeah. Exactly. Yeah,
like
yeah,
a glass of wine or
well,
a beer
a
or.
glass of wine's not anything to worry about, but certainly if you overdo it and smoke on top of it, yes. I'm
see.
talking about the alcohol, the whiskey,
Any
all that good stuff.
Okay.
Yeah.
Okay.
Okay.
Well, gosh, I didn't know that.
Yeah. So, but you don't smoke. You're okay.
No, but I used to.
All right. Well, that's
and I
okay.
drank and smoked together.
Okay. Well, you're fine now. So,
Good.
but it could happen, but it won't. All right.
Yeah.
Don't worry about it.
Yeah. Okay. Well, but so now mostly you can get the mouthwash, and you can use it as many times a day.
Sure. Yeah.
As long as it doesn't have alcohol in
Yeah.
it. Then.
And these mints, if you get a sugar-free mint, some of them have sugar in it. So kind of watch that. They make several sugar-free now. Sugar's the culprit. Sugar's doing it.
Okay.
And sugar, it feeds the bacteria. That one bacteria I was talking about. And if you're already predisposed to tooth decay, it will happen. I've seen a lot of people a lot of elderly people will suck on candy, even take it to bed with them because they have a dry mouth, and that you can tear up some teeth real fast on that. I've seen that happen too.
Ooh.
They take it, they put one in their mouth and sleep with it in their mouth. So you can imagine what that's doing.
Yeah. So, well, any kind of then candies or things that you suck on.
Yeah.
But if you, so for example, if you have a piece of pie with lunch, it's probably good afterward to brush your teeth.
Yeah, but no problem, because that piece of pie during lunch, that means you're not nibbling on it throughout the day.
Okay.
It's you know how I see it with bank tellers sometimes. But they always have the candy out to give away. So a lot of them will sit, and they might only do it 3 or 4 times a day. But if you think about it, you have just increased your chances of all that sugar buildup throughout the day. So if you can get sugar-free, that's certainly better.
Yeah.
So you see a lot of people that have it sitting out during the day. They don't think they're eating that much, but if you do it just several times a day, that's a lot.
Yeah.
Even if it's one, several times a day.
Yeah.
So eat a bunch of them. If you're going to do it, eat about 10 or 12 of them real fast. Then you'll
And then forget it.
That's what I chew them.
Yeah.
Crunch them.
Yeah, there you go. There you go.
All right.
So now, is there anything else then that we need to cover on those today, or?
I think we've worn everybody out on oral hygiene. This is
Well,
it's
it's so
hard
important.
to make. It's hard to make this exciting. Next time we'll try to get a better topic than oral.
Well, I
Is this
think
good?
it's.
Have you learned anything?
I've learned a lot.
Okay. How often should you brush your teeth?
Well, twice a day.
There you go. All right. And for how long? What
2 minutes, and I have an electric toothbrush.
Okay,
that
those are-
does mine for 2 minutes.
Really? Okay, they're good too. A lot of people ask, is electric better? Anything you use. If you don't like the electric and you don't like how it feels, don't use it, because you won't use it as much.
Yeah.
But I know that my hygienist, Elaine Downs and Tina Borders, they both recommend using the Sonicare, the ultrasonic type, which vibrates at a real high frequency, and it vibrates the plaque off, and they're pretty amazing. I don't use one myself, but I just don't like that
Mine might be
feeling. But some
sonic,
people
I'm
love
not
it.
sure. Yeah.
Some people love it. So whatever you're going to use, that's the kind you need.
Yeah.
If you like a little pink one, use the little pink one. So
As long as you do it for 2 minutes.
2 minutes.
And it's really handy when the one I'm using, because it does it for 2 minutes, and then it's already doing it a certain way at the angles it should be, I guess.
See there?
All of that. So, well, I mean, it's just made it easy for me. So I'm glad that I have it. So otherwise, I'd never done 2 minutes.
I wouldn't either. Who knows?
So,
But there again, and
I'm going to alternate sides of my mouth.
because we all get lazy, and you
Yeah.
think you're going to do it for 2 minutes, and somebody asks you a question, you're done.
Yeah.
So I tell some adults to use children's toothpaste, because that adult toothpaste sometimes burns. It kind of stings after a while. You know how kids hate that taste in there? A lot of adults do too. It kind of stings. So as soon as it starts stinging a little bit, you'll quit brushing. So get you that Crest kid stuff. So that's fine too. So anything.
But it does need to have the fluoride.
It should
in
have
it.
fluoride in it. Yes, we get it. There's enough fluoride if you drink in the water. A lot of people don't drink tap water anymore. That's a whole other subject too. When people started drinking bottled water, it does not have the fluoride in it.
Right.
So you might need a fluoride prescription that we give people sometimes.
And
chew up a little tablet before they go to bed.
Because if you don't have enough fluoride in your teeth, what does that do?
Well, it makes them weak. The fluoride, there's a bond the fluoride bonds to the teeth. There's an OH bond that it replaces and makes the teeth stronger. And that was done. That was another just a discovery made out in Nebraska from somebody's tap water. It was groundwater, and there was fluoride in it. This one little town didn't have any decay in it, and they didn't know why. And they tested the water, and it had 1 part per million fluoride in it, and that was just by happenstance they figured that out.
Mm-hmm.
So that was done.
And
So
as a
that's
result, well, now we have fluoride in our toothpaste, and
And
we
our
have it
water.
in our water.
Have it in
But
our
you know, I
that
just
used to be controversial, but
Yeah.
now since 1968 we've had it in Springfield's water. So you're getting plenty of fluoride if you drink water. Just if you have
if you're drinking tap
if
water.
you drink a little bit, yeah. You don't. It doesn't take a lot, but just one.
Okay.
But if you're having a lot of caries, a lot of cavities, then you might want to look at maybe using a prescription toothpaste, and some people use that. There's a prescription toothpaste that has 5,000 parts per million in it that we use. Some people that give it to some people to use. So and it's hard to overdo that. You'll get something called fluorosis if you overdo it, but I haven't seen that in a long time.
Okay. So, okay, make sure you have the fluoride. Okay, well, I think this is very interesting information.
Good. I'm trying to make it.
And,
It's-
you know,
it's
I
a
want
tough
people
topic.
to have healthy teeth because, like you say, every day, you know, I see people walking around that do not have good teeth. And, you know, I would think we're at the point in our state and county that should not be such a huge issue. Now we've got insurance companies that are providing dental care.
Yes.
And so, you know, if people are taking care of their teeth, doing these preventative measures that you're talking about, then maybe they'll be able to keep their teeth throughout
They
their
can,
lives.
and I understand. We see so many people that are. Every day somebody says, "Oh, I'm embarrassed to show you how bad it is." You wouldn't believe it. You're not the worst. I guarantee you're not the worst. So so we see it all the time, and it is. I can understand. You know, there's a apprehension about coming to a dentist. You know, if you have, you know, if you're worried about that, and I understand that.
Yeah.
You know, we keep everything private, and you know, there's no Snickers. We've seen it all. So you know, you
Yeah.
can't.
You can't be embarrassed by their
I've seen
dental
it.
condition when
I've
they
seen
come
it all.
out to your office.
I've traveled all over South America and Africa, and I've seen it all.
Yeah. So if anybody would like to get in for a consultation or teeth cleaning and checkup and all, they can call your office
Yes.
at, what is that number?
859-336-7680. 336-7680. And yeah, it's and if you can't get in right away, usually, you know, it's not that big a deal. But if you're having a toothache, certainly give our office a call, or a dentist, any dentist around here that can get you in and take care of that. It might go away, but it's going to come roaring back. Yesterday was the 4th of July, and I saw 3 people yesterday after hours. So
Oh, my
a
goodness.
lot of times it'll hit, you know, when you don't expect it.
Yeah.
So
So get in for your checkups and cleanings and
routine care.
routine care.
It's just like anything else.
Yeah. So, well, thank you,
Okay,
Johnny,
that's
for
fine.
being
Yeah,
here today.
thank you. Thank
I
you,
look
Lisa.
forward to seeing you
Yeah,
again.
okay.